Hello, I'm Emma and I'm a neurosurgeon.
So what first sparked your interest in medicine?
I think, to be honest, it was actually more of a research lean from my background in science that I felt that going down the direction of having clinical application for that science would be, really interesting. And so that's why I started doing medicine. But obviously, then I stayed there.
And what made you decide to pursue neurosurgery?
Well, and again, I don't really know. I was going to do pediatrics. I was going to do rural general practice initially, and then pediatrics, and then I ended up doing a term in neurosurgery and found it really engaging, and ended up doing more and more of it, and then I ended up just doing that and going down the pathway of training and specialising in neurosurgery.
Fantastic. How many years did it take to train to become a neurosurgeon?
Lots. So I guess I did 2 years just in neurosurgery before I started training, and then when I started training was in 2012 and I graduated at the end of 2017, so that was 6 years of full-time training.
And did you have any standout teachers or mentors along the way?
Oh, look, I think you take something from everybody that you work with, but certainly I always had the benefit of really having some good support from some of the consultants that I met along the way, and they've continued to support me in my early consultant years. So no question that support's been very important to me in my career to date. Working with some of them here at Flinders that I've come back to for that reason, but there are others who are interstate and overseas who have also been important in that journey.
And was your medical school, was that here in Adelaide?
Yes.
Yep.
So I came here from Western Australia to do medical school here at Flinders, and I did my pre-vocational years at the Royal Adelaide and here, and then training moved me interstate and overseas. So I spent time in Christchurch in New Zealand, as well as Townsville and Brisbane in Queensland.
And how did you find that experience training overseas in Christchurch?
Yeah, I had a really good year there. Again, a really supportive unit, a lot to learn, and it was a good opportunity to explore the cultural nuances between here and our friends across the ditch.
What are your particular subspecialties or areas of interest?
So general neurosurgery has always been, what interested me. I'm now working towards being able to get the deep brain stimulation service up and running again here at Flinders Medical Centre. So that's become a focus of mine in the last 12 months. But we all do a little bit of everything here, and that's what I enjoy about it. I think having the opportunity to do both the emergency and the elective work and still see a broad range is what keeps me interested in my job.
Yep. And we're here at Flinders, so where do you currently operate here in Adelaide?
I'm mainly here at Flinders Medical Centre. I also do some work at Memorial and trying to get organised to get started here at Flinders Private as well.
Yep. And can you give us an example of an average day in your life?
I don't think is there really an average day in neurosurgery. I think that's part of what keeps us interested in doing it, is that there's often nothing average about what happens, But I guess in my public appointment, I get up, get to work. We generally have either operating theatre or we have clinic to get done, and we manage that amongst any emergencies that come through the door. We do on-call after hours, and balance that as well. My public work and my private work and my family. They occupy 24 hours of every day altogether.
What's the most hours you've ever worked in 1 week?
Oh, look, I've forgotten. More than 120. I don't know how many hours are there in a week.
That's a good question.
Yeah.
What's the longest you've ever gone without sleep?
I've had 2 babies, so a lot.
Nothing to do with neurosurgery.
No. People often ask me what's harder, right? Motherhood or neurosurgical on call, and I'm like, motherhood by a long shot. It is relentless. Relentless. You'll always get a day off call eventually. Yeah, not with kids.
What was your first surgery on a real patient?
Oh, I don't remember. I guess in neurosurgery, you start on the simple things. It would have been insertion of an intracranial pressure monitor.
What is the longest surgery you've ever performed?
I would have been involved in combined cases. It would have been, 16 hours straight. Yeah.
What's the most complex surgery you've ever performed?
Again, it's every surgery can be more complex than you anticipate when you start out. So, probably complex cranial dural AV fistula. Yeah.
What's the most surgeries you've ever performed in one day?
Oh, again, who keeps count? Probably 6 or 7 with some small cases and some longer ones combined.
And what's the most common surgery that you perform?
Sort of lumbar spine surgery, decompressive laminectomies and microdiscectomies would be the workhorse, the most common surgeries that we do.
Coffee or tea?
Whichever's available.
Sweet or savoury?
Again, depends what it is. First savoury, then sweet. Except life's short, so sometimes sweet, then savoury. Yeah.
Do you have a favourite sport or tea? What are some of the things that you enjoy most about your neurosurgical career?
Again, I think it's varied work and it's interesting work, and there's always something to learn. So it's always, it's challenging. I guess the perception of neurosurgery is that it's hard, and it can be hard. It can be hard, physically. It can be tiring. It can also be challenging from the perspective of the more nuanced decision making that we do, and the complexity of the problems that we face, and just that every problem is unique. It occurs in a unique person, in a unique situation, and so it's always having to put all of that together in terms of what we do and the decisions that we make that keep us interested, I think.
And do you have a standout memory of your career so far that you'd be willing to share?
I was struggling with that one. I think that there's a lot of highs and lows in neurosurgery, so they tend to balance each other out a little bit, and it's easy when you're thinking about the standout memories. They're not always of positive things. So I guess you have to celebrate the good outcomes that we see, and certainly I think back through my career to date and the people that I saw. I remember one young person who had a very severe injury, and the opportunity to see them 12 months later walk into clinic, back to their life and independent. Those are the moments that really are a standout in this area.
And what advice would you give to a student who is interested in pursuing neurosurgery?
Think hard about your life choices. That it's a hard road but rewarding, but you need to make the decision early that it is what you want to commit to. That it will have its challenges, and you have to have broad shoulders to carry that at times.
August is Neurosurgery Awareness Month. Are there any aspects of neurosurgery that you wish there was more awareness around?
I think that any subspecialty that you work in, there's often a lot of misconceptions around it in some ways. I guess I need people to be realistic about what can be achieved and what can't be achieved. I guess a lot of the problems that I see don't have quick and short-term solutions, and that a lot of problems that occur in neurosurgery, when you're talking about recovery, especially in the central nervous system, it's not overnight and it's not quick, and it takes months and years. And I guess something I'm often talking to people about is recovery from brain injury or spinal cord injury. and that you won't know where things are at for 12 months, you know, and that all of your external wounds can heal, but there's still internal, you know, neurological healing progressing, and that it requires a lot of patience. Those things require a lot of patience. And, you know, that's part of our job, is to be here to reassure people they need to keep going, and to try and, you know, minimise those frustrations that come with those issues that do take a long time to improve.
Yeah. What do you enjoy doing in your spare time?
I have a family, so I have 2 small children, so I have no spare time.
How old?
3 and 7. So look, we enjoy spending time in nature and bushwalking and gardening, and I like sewing. That's sort of career related, I suppose. But, you know, realistically, just at this point in my life and career, I don't have a lot of spare time to spend on anything.
Do you have a quirky or interesting fact about the brain, spine, or neurosurgery?
A question I often get asked, for whatever reason, I don't know why people specifically find this interesting, but is about the consistency of the brain. And in describing it, the best analogy I've had for it is probably silken tofu. Don't like making food analogies in surgery, but that is the thing that people best understand, I think, in terms of what the brain's consistency is actually like in life inside the skull.
Right now I'm thankful that I'm not a tofu fan.
Yeah, no, fair call.